For today's top story, we're going to be looking into the topic of mental health and occupational therapy. To you, Ashley.
Thanks, Cora. I'm Ashley, and today we're going to be talking to 3 occupational therapists about the background in mental health.
In the early 1800s, the moral treatment movement introduced humane care using meaningful activities. The mental hygiene movement emphasized prevention and early treatment, linking mental health to biology and lifestyle. Eleanor Clark Slagle's habit training and post-World War I reconstruction aids used purposeful activities and crafts to support recovery, shifting OT from hospital-based care to functional rehabilitation.
After the Community Mental Health Act in 1963, care moved into communities with OT supporting independence and reintegration. Today, the recovery model guides practice because focusing on empowerment, personal goal, and meaningful occupation rather than illness alone.
Amazing, Cora. And OT and mental health continues to evolve towards holistic and community-based care using technology, advocacy, and collaboration to promote wellness, inclusion, and long-term recovery. Professional associations are working to expand OT's recognized role in mental health despite challenges in recognition, reimbursement.
What are the settings, conditions, and populations that impact the OT role?
So to start off, mental health disorders are characterized by issues involving mood, thoughts, and behavior. They may also be referred to as psychological disorders, mental illnesses, or mental health conditions. Mental illness affects around 1 in 5 adults in the United States.
Depressive disorders and anxiety disorders are among the most common mental health disorders. The rates are higher in females, young adults, and adults identifying as more than 2 races. The most common conditions supported by occupational therapists include anxiety and stress-related disorders, depressive and mood disorders, ADHD and executive function disorders, schizophrenia, and severe mental health illness.
Mental health professionals help patients achieve recovery goals in a variety of settings. This includes acute care, inpatient facilities, outpatient programs, and private practices. Professionals in this field can include psychologists, counselors, clinicians, therapists, clinical social workers, and psychiatric or mental health nurses. Occupational therapists also play a key role as part of the interdisciplinary care team. The typical settings include acute, inpatient, and outpatient.
Speaking of settings, let's take a look at our first setting, acute care. We're here in an acute mental health setting where occupational therapists focus on stabilization, safety, and restoration. Acute hospital stays are not designed to address longer core issues, so outpatient follow-up care is crucial to ensure the best outcome. Now we're going to talk to a patient who's about to discharge and her experience with OT in the acute care setting.
When working with the OT, she helped me develop coping skills and learn how to re-engage in daily life through structured activities. We focused on improving self-care, emotional regulation, and problem solving, as well as building practical life skills like medication management to support my safe and successful transition back into the community.
In inpatient settings, occupational therapists address the functional, cognitive, emotional, and social challenges that affect a person's ability to live independently and meaningfully. Inpatient units are monitored 24 hours per day in a secure hospital or treatment facility. Coping strategies are currently being practiced. The occupational therapist is guiding patients in coping techniques, specifically relaxation exercises.
During my sessions, I've been a part of group therapy that works on social skills and coping mechanisms, which help me with my practical life skills like hygiene, money management, and my OT-created individualized plan.
In outpatient settings, occupational therapists focus on long-term recovery, wellness, promotion, and the prevention of relapse. Outpatient is considered the lowest level of care, typically involving meeting with an occupational therapist and psychiatrist weekly.
My OT helps me plan healthy routines and find activities that keep me motivated.
All occupations are involved in the practice area of mental health, as engagement in meaningful activities supports emotional, physical, and cognitive health. Occupational therapists' distinct value lies within holistic, client-centered care, focusing on participant promotion and resilience, as well as supporting integration across the continuum of care.
Occupational therapy promotes health and wellness by teaching coping strategies, building healthy routines, reducing environmental barriers, strengthening life skills, empowering resilience, supporting early intervention, promoting occupational justice.
While occupational therapy and mental health helps individuals recover and thrive, Involvement, advocacy, and access to resources are also essential for mental health support. You may be asking yourself, how can you get involved? So now we're going to talk to someone who can shed more light on this topic.
To learn more about OT and mental health, you can go to the Occupational Therapy in Mental and Behavioral Health resource or the Occupational Therapy Guidelines for Adults Living with Serious Mental Illness, both searchable and accessible through the AOTA website. The National Institute of Health has a collection of brochures and facts on mental health disorders and related topics. The intended audiences include patients and their families, health professionals, and individuals seeking more information.
Can you tell me more about what occupational and mental advocacy is?
Yes, of course. Advocacy can happen at all different levels. You can go to the Advocacy tab on the AOTA website to learn more about getting involved. To actively advocate for mental health now, you can support bills on mental health and advocate for more transparency on mental health issues. The Legislative Action Center provides an easy avenue to contact legislators about a bill. One of the most recent bills in the legislation was the H.R. 4037, Occupational Therapy in Mental Health Parity Act, which would ensure insurance covers mental health OT services equally to physical health services. Practitioners and community members can also get involved on a state and national level. The Mental Health Association in Michigan is a statewide organization that evaluates programs and services, recommends improvements, and works to make sure people have access to the care they need.
Ways students can get involved in mental health advocacy specifically is to join an Active Minds chapter. Active Minds is a national nonprofit that promotes mental health awareness among young people and has student-led chapters at different colleges.
That is a lot of great information. How should we stay up to date on any new changes in advocacy opportunities?
The Advocacy News tab on the AOTA website is a great way for everyone to stay up to date with occupational therapy and mental health advocacy information. For specific information on mental health and OT, check under the Mental Health section in the Practice tab on the AOTA website.
Thank you all for sitting down with us today and educating us on mental health and occupational therapy. Now that we know more about occupational therapy in the mental health setting, you can get involved. Go to the website of Active Minds Mental Health Association in Michigan, National Alliance on Mental Illness, or the Advocacy tab on AOTA's website to learn more. This is Ashley of Occupational Therapy Student News, Channel 635, signing out.